Do you start with that procedure, and with a lot of people after they've, they do their initial assessment and stuff like that? But I know that it leads into, like with, you've said things like veneers, you typically start with that, and then also with a lot of other procedures.
Anytime somebody comes in and says, Dr. Swift, I want a better smile.
Right.
We start breaking down what we can and can't do. Sometimes we can get there with whitening alone, okay? Sometimes it requires some porcelain. But we're going to match that porcelain to your other teeth. So almost everyone starts with some whitening so that the end product, then everything's bright.
Now, I've heard some information about the whole teeth whitening procedure and how it affects someone's personality or psyche.
Well, we age by our teeth darkening as we age. That's part of the way a tooth ages. And so to reverse the aging process, taking that dark color out, it's the least expensive facelift you could ever ever get. And it does lift faces because everybody's looking in the rearview mirror, and I hear that all the time. On the way home, I kept looking in the rearview mirror. I couldn't believe it. Couldn't believe how white they were. So it brings smiles, and it then makes the patient want to do better keeping things clean, too.
Well, the other thing, even with when I went through the procedure, the thing that I noticed is that beforehand, when I was talking to somebody, I would typically just allow my teeth, I'll say, to be covered.
Yeah.
But yet afterwards, I noticed that, I'd talk and there would be,
smile.
there was just it was an okay, because I knew that my teeth looked good.
Yeah. Oh, good. Yes,
I mean,
you
could tell they look.
Oh, it does. It definitely has a lot to do with self-esteem. And we've even had situations where we've improved the patient's smile, but yet they were so much in the habit of guarding it that they almost had to learn how, teach them how to smile again without that hand going up, or with, it takes a while,
I believe that. I believe that. And then I know that even that a lot of times that once somebody can smile again, their attractor factor, so to speak, goes up, then they start feeling better. And I know you've even had stories where people started looking better.
Oh, yeah. They get
lost
raises.
Weight
Yeah, they get
like
raises. They lose weight. They find their spouse. Yes, good things happen. Good things happen when you smile more.
I completely get that. When we look at some of the current technology, you said, like when they went in and did my teeth, they had the what do you call it, the paste, or the blue stuff?
With the bleaching agent.
Yeah, the bleaching agent.
That was activated by the laser.
Right. Okay. And then they removed that, and then they went in and we put some trays in for a while.
A recovery gel. We, one of the maybe complications with tooth whitening is sensitivity. And we have ways to deal with it, and I think that separates us from a lot of offices. So when we get back, let's talk about what we do in my practice too.
Well, I would like that, because the thing, I was surprised for the first few days afterwards. I would say something, and it would be, and it'd be like this.
My daughter called it lightning bolts in your teeth, and I thought that was a perfect description of it. It has to do with the tooth rehydrating. During the bleaching, we're dehydrating. But there's things you can do to help the patient.
I just remember it was a little bit like somebody taking a tuning fork.
Was it worth it?
Yeah, because it was so, it was so minor. This is a business spotlight. And Dr. Mary Swift is the 2011-2012 Consumer Choice Award winner for Cosmetic Dentistry. Fabulous show. We've got a couple more sections where we're going to show you more about keeping your smile on. We'll be right back.
I've worked every position in the office. I've been a dental assistant, I've been a hygienist, and now a dentist. And it's made me a better caregiver on every level for my patients. One of the things I think I've learned over the years is where to put my technology money. You can buy the latest and greatest and it sit on a shelf, or you can figure out within your practice what's going to make the patient experience better. My practice offers several cosmetic procedures that are enhancing smiles with whitening, with Invisalign, the invisible braces, with porcelain work. So we see people's lives improve when we give them a beautiful smile. That's rewarding. The latest and greatest tool I have that keeps me excited is probably the Invisalign, invisible braces. It has allowed me to evolve my practice into a philosophy of move it, don't remove it. In other words, where I was before I had that tool, move it where I want it instead of putting something on top of it. Staying involved in dentistry on every level, local, state, and national, makes me a better dentist for my patients. I would hope that my patients would feel that from that phone call, even that initial phone call, all the way through to the end of their experience, that it was the best care they've gotten ever. When a patient, especially a very nervous patient with some dental anxiety, when they send their friends and family to us, then we know we've done a good job. That's the biggest compliment we can receive. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.
You can become a published author. Discover a system that will lead you from idea to having your book on the bookshelves. Bob Baer pulls back the curtain at the More Power to Publish workshop. Watch and learn how to follow the step-by-step plan to turn your idea into a published book. Learn more at morepowertopublish.com.